So we actually talking about the possible causes of secondary peritonitis. All right, where we said that peritonitis in general is simply what the inflammation of the peritoneum. Okay, so if there's inflammation of this peritoneum, it could be due to perforation of an abdominal mass, abdominal abscess. Right now, let's relate this. Abdominal abscess, if they say there's an abdominal abscess, the abdomen is not one thing, okay? There are so many organs that are making up the abdomen, all right? So if they say there's an abdominal mass, it could mean that probably one of the organs in the abdomen pus accumulated and all that, formed an abscess, and it can perforate. So if it perforates, you know what is in an abscess, right? The bacteria are also in an abscess. So if it perforates, it can lead to what? Spread of that bacteria to other places, particularly what the peritoneum. This can cause the peritoneum to become what? Inflamed. Now it is secondary peritonitis because what? It is something else that is causing the peritoneum to become inflamed, right? So let's quickly talk about it. Now, you can see one of the most common what abdominal abscess could be appendicitis, like inflammation of the appendix. Okay, so perforation of an intra-abdominal abscess can cause secondary peritonitis through the following mechanisms. First of all, it will lead to release of bacteria, right? So abscess perforation allows bacteria to actually escape into the peritoneal cavity, leading to infections, just like I told you guys, right? Then spillage of pus. Now, pus from the abscess can spill into the peritoneal cavity, causing inflammation and infections. Contamination of the peritoneum. Perforation allows the abscess content to actually directly contaminate the peritoneum, leading to infections, right? Spread of infections. Bacteria from the abscess can spread to adjacent organs and tissues, and this can cause a further infection and what? Inflammation, right? Then moving, we said that this can also activate what? Inflammatory response. So basically, perforation can trigger what? A severe inflammatory response, leading to increased blood flow, edema, and further tissue damage. Adhesion and abscess formation. Perforation can lead to what? Adhesion formation. Then new abscesses can form, okay, and this can perpetuate the cycle of what? Infections again, inflammations again, right? So common intra-abdominal abscesses that can cause secondary peritonitis include, that's if they are perforated. We have the appendiceal abscess, that's what? Appendicitis. Okay, diverticular abscess, that's what? Diverticulitis. We have pancreatic abscess, that's what? Pancreatitis. We have hepatic abscess, that's what? Hepatitis. We have splenic what? Abscess, okay. We have what? Renal abscess, which could be what? Pyelonephritis, okay, or any inflammatory condition of the kidneys. If it becomes perforated, this can cause what? Secondary peritonitis. All right, so that's it.